I have given this conference in China, and I talk around the world. I'm a holistic dentist. Anybody familiar, any of the other dentists in the room familiar with the concept of holistic dentistry? So holistic dentistry is very well recognized in the United States and coming into Europe. It's about being more natural, so we look for alternatives to root canals. We do metal-free dentistry. Of course, it started with not using mercury amalgam and BPA-free composites. So my office is in Tribeca, New York City. I also have a part-time on the Columbia College of Dentistry in New York. And that's my. So holistic dentistry has been around, started with Dr. Weston Price, and he wrote 50 years ago about alternatives to root canals and how the diet, the Western diet that is not just American, but in Europe, and is so bad for your teeth because of all the sugars and the processed foods, and that when he did studies of older populations, third world populations, they often didn't have any dental decay. And we know that a lot of it came hundreds of years ago when sugar cane was discovered, and that by using an alkaline diet, which is basically low carbohydrates and promoting things without phytic acid, and we're going to talk about that you can actually prevent tooth decay naturally without fluoride. So that's a really big concept of dentistry, and I would say that most of us dentists would say, well, we know that acids from bacteria cause tooth decay, that anaerobic bacteria prefer an acidic environment. Yet dentists have continued to ignore the alternative to acidity, which is alkalinity. And I have a product that I've given you all samples, which is called Alpha White, that I developed. It's an effervescent portable tablet, and it's very simple. You just break off a piece, and you can just chew it up and rinse it out if you're on the road. So you can take it anywhere, or you take the tablet, a little bit of warm water. It's like an Alka-Seltzer. It effervesces, and you wash your mouth out, and it prevents tooth decay. It freshens your breath. It's good for wound healing. And it is actually a natural tooth whitener. It's not a bleaching agent, but it should be part of a bleaching treatment, because when you bleach teeth, you strip the enamel and it makes the teeth more sensitive. So chemically what happens is in an alkaline oral environment, the teeth can remineralize. So it is really the only way to naturally try to cure tooth decay. And we're going to go through this pretty quickly because this was meant to be a 2-hour lecture. I gave a lecture this year to the Integrative Healthcare Symposium for 1,000 holistic physicians in New York, and they were just blown over that we as dentists could do things less invasively than they've always thought dentists did. And there's concern now with root canals causing problems with people's diseases. We're going to do this quickly. Stem cells, we all know. So for instance, holistic dentistry. In our practice, we don't use any animal or cadaver bone. Any allograft. If we do an implant, first of all, we're sort of anti-root canal. So if a tooth has been infected, if a tooth's alive, we try to keep it alive with IRM, which all of you have in your toolkit. It's a natural desensitizer of the nerves. So we will do everything we can to keep that tooth alive. If the tooth is already non-vital, I'm not talking about just the pulp exposure of a live tooth, but if the tooth is actually has any infection where you see a radiolucency, we will recommend extracting that tooth with ozone cavitation. Ozone is ozonated water to cleanse the socket, and then we would use a zirconia metal-free implant. But for the grafting of the site, we use your blood stem cells. So our surgeon draws blood. He has a centrifuge from France. Anyone can do that here. It's extremely popular in New York. Nobody wants pig bone, animal bone, cadaver bone anymore. So a lot of the things that are being done in the universities with these products that are manufactured, I'm not saying clinically whether one is better than the other. I'm just telling you what the marketplace is saying is that people don't want animal bone. They want their own product. So we use your own stem cells. So it's a very popular thing to do. And then a cavitation is using oxygen. So we talked about alternatives to root canals. Basically, you try to keep the teeth alive. If you have a pulp exposure, you can use Vitrabond. We wouldn't believe in an apicoectomy. you know, an apicoectomy is you're taking that dead tooth and you're cutting off the end of the root, but what happens to all the other tubules that are still infected? And really an apicoectomy, and really root canal is a temporary solution at best. So maybe you do minimally invasive dentistry. You wouldn't do your 3-ring bridge. We also do an integrative practice where we use all these other modalities to help people with all different kinds of infections, orthodontic breathing. We do a lot of sleep medicine. It's become very popular in America. People are sick of the CPAP machine, so we use an appliance to reposition their teeth. I'm sure most of you are familiar with that. We also use for diet. This is where I think one of the things I'd like to talk about here, because as dentists, we don't really deal with nutrition, but there's a lot of things. In my office, we have an integrated practice. So we have all those cranial sacral therapists. We actually have a nutritionist full-time on staff. So every patient comes in and at least meets with nutrition. Initially, it's complimentary, the first session. If they want to go with the program, whether it be for mercury detoxing or for oral chelation, or becoming more alkaline. Now, these are things, it's like giving up a habit. It's like quitting smoking. They need somebody to help them. So it's not so much an income builder, because you know the nutritionist is being paid by the patient. They rent space. But what it is in your practice is value addedness. It's showing that you as a doctor are not just looking to be a shoe repair person. You want to be really a doctor of their oral health. And I don't know how dentists have ignored the value of nutrition and how you can change things like osteoporosis. You can improve. We can improve. Anybody here familiar with the mercury removal technique? Does everybody do mercury removal? You're all dentists, right? Everybody dentists? Yes. Yeah. So when you take out your amalgam fillings, do you use a rubber dam? Okay, so that's one of the main things that we would promote. It's what's called the SMART technique. It's promoted by the Holistic Dental Association in both America and Europe, basically using a barrier technique like you would for a root canal. You're putting a rubber dam over the teeth, you're using suction. You're trying to prevent exposure of that patient to the mercury that we all know is in the fillings, but you know, we trying to not expose them to it. So that's pretty simple. We're not going to get too much into mercury here. In America, it has almost been outlawed. I don't know if in any of your countries, are they still using, whose country still uses mercury amalgam? Anybody here?
Brazil, yeah.
Yeah, you're still using? You're still using. What country are you in?
USA.
USA. Well, that's true. USA is not been completed. That's not true. Only a few of the dental schools, like NYU, have decided to take it out of their curriculum. But I go to Columbia, and they do teach mercury removal, because it is still considered the standard of care in America. So I'm not saying, I'm just telling you what holistic dentistry promotes. Whether you believe in mercury or not, we can take that outside. But you know, it's obviously there's things that many people don't want to have mercury fillings. So this is more about what the public wants, marketplace. And I've been a dentist now almost 40 years, and I've been a dentist almost 40 years. I don't know anyone who wants mercury fillings from a dentist anymore. But my point is that holistic dentistry has gone beyond the mercury. It started with Dr. Hal Huggins about 40 years ago, and he lost his license in America because he was promoting that removing your mercury had medical benefits. And when I started as a holistic dentist, you had to be very careful. You could not tell patients that there was medical benefits in removing their mercury. But we don't even say anything anymore. Basically, the word is out amongst Americans and all over the world, I think, that mercury is unnecessary, that you can get a very good result with either a resin or a porcelain filling, and there's no reason to use amalgam, whether you believe it has medical benefits or not. And people basically want white teeth in the end. They don't want metal teeth. So even gold, which is still a very good material, you get good quality gold. I don't find many patients wanting gold inlays these days. But I want to get back to the alkaloid, which I gave you a sample. If you're interested, already one of the doctors here from Saudi Arabia has bought for cases of it for his Saudi Arabian dentist. This is the way you would buy it on Amazon. It's an effervescent tablet, and it also comes in a mint flavor, which is I think what I gave most of you, and a turmeric. And turmeric is a very powerful anti-inflammatory herb. It's yellow. It also is a tooth whitener. So interesting, even though it's stain your sink, it'll stain your white clothing, it doesn't whiten your teeth. But what it's really, really good for is for patients with periodontal disease. Because most of us as dentists are only offering chlorhexidine, which is chlorine, to kill bacteria, and we're not addressing the underlying environment of the mouth. We as dentists have been completely blind to the fact that we are treating an environment. And by raising the pH to an alkaline level versus acidic, and if anybody wants to measure their pH and doesn't believe me, I will show you after we leave here. I have pH strips with me, and I will show you that how it will take your acidic pH, which happens when you get dehydrated, and if you've been speaking or you wake up in the morning, you've been drinking alcohol, or your diet may be an acidifying diet. Most of us who are eating less vegetarian foods are going to be acidic. And this product will immediately alkalinize your mouth. And the other important thing is a lot of patients who are into this alkaline diet, they take a lot of fruits like citric acid fruits, like lemons and vinegar water, which we know is very good for cleansing our bodies, for lowering our blood pressure, making us healthy. But they ignore the fact that these acidic foods erode your teeth. So if you take this product right after taking vinegar, it'll protect your teeth. It neutralizes the food acids immediately that are on your teeth. And so there's many uses of this. It's also a really good wound healer. But the main component is it raises your saliva pH. When you're eating all these other acidifying foods, things like sodas and all those things are really bad. All of these, the pH, even energy drinks like Red Bull has a pH of 3.5. Your saliva should be a little over 7. 7 is like neutral pH. If you take a product, the alkali product, it will raise your pH up to almost 8, in which it's no fluoride, it has no sodium laurate, no alcohol. Trichloroset is in a recent article this week in Science Times, how all the toothpaste has foaming agents like sodium laurate and trichlorosin, which is now considered to be a cancerous agent in all toothpaste. So what is toothpaste? Toothpaste is just a carrier for fluoride. We all grew up being trained that you needed a tube of toothpaste on your counter. It wasn't that way. Before there was toothpaste, there was baking soda powders, tooth powders. The Alka-White, which I developed and I have a patent in US for, has baking soda, coconut oil, other natural essential oils, and it prevents tooth decay, and you can just take it on the go and it makes your mouth feel fresher.